Hey, welcome. I'm Dr. Carberry. Today I'm going to talk about a condition that a lot of my patients come in with, especially people who've had chronic neck pain for many years and exacerbating, increasing stressful pain in the upper back. What I've found with 80 to 90% of people in this category is there's an alteration of the curvature of the neck. Now let me explain what I mean by that. This picture right over here is how a postural configuration should look, and the representation of how the spine should be curved toward the front of the body like a banana, with the center of gravity of the head over the center of gravity of the lower body. Now let's go look at an actual x-ray of someone who has lost this normal configuration in their neck. This x-ray is of a 22-year-old young man. He did a lot of years of his life dancing, and he had a number of falls on stages and on hardwoods, and it caused an alteration. Instead of the curve going toward the front, he actually has a reversal of curve, and he actually has what's called the beginning of an SCurve. This is a major problem that needs to be corrected, and if it's not corrected, it'll lead to degeneration of especially the vertebrae in this area. Let's take a look at what happens downline in that regard. Here is an example of a straightened neck that's been like that for some time. And we can see down in this region right here how the shape of the vertebrae are actually starting to peak and lose their normal configuration, and the disc spaces are getting thin. And this right here is the result of that loss of the bowing that a neck is able to translate the forces of the head coming down the body and translate some of those forces in a horizontal direction. When that's gone, things start to wear out. Now let's talk about what to do about it. James, come on in. James, I want you to lie right down here with your head on this end. This is what I call something to push the neck in the more normal configuration. And it's very easy to use. It just goes against the upper back, and then the head drops back over it with the chin a little bit to the forward side of the straight up and down. Very easy to use. One starts by lying on that for 4 minutes a day, 4 times a week. Come on up. Have a seat right there. The other thing we use is something that I call a device that pulls the neck in the correct configuration. And it goes behind the head like this with these little hand grips facing upward. Put it behind the head. You start with the knuckles upward and your chin down. And while you're pulling forward, chin goes up, hands go down. And you just roll that neck like that. Minute or two every day, pulling that curve back, working on those muscles is very effective. Try it. Start with your hands up, chin down. Now bring your chin up and hands down. That's it. And you're pulling forward while you're doing that. How's that feel?
It feels great.
Yeah, excellent. Okay, my friend. These kind of simple at-home devices will, over time, and it does take a while, if a neck is of the configuration like we saw in the x-ray, we're talking years of work to gradually move this back into a more normal configuration. But what I found with my patients, it only takes 2 to 4 weeks for the symptoms to start changing dramatically. And most of this work can be done at home with some background chiropractic support in office. Thank you for listening. If one wants to know more about it, I will talk to people individually. Thank you so much.